If you are a doctor specializing in lower limb orthopedic surgery, you are aware of the dilemma in prescribing anticoagulants to patients. During the next 3.5 minutes, you'll be introduced to ActiveCare, the only non-pharmaceutical therapy that was proven in numerous clinical studies to be non-inferior to anticoagulants in DVT prevention without elevating the risk of serious bleeding complications. ActiveCare treatment will solve your dilemma. Normally, in order to prevent blood clot formation during or after lower limb surgery, you will prescribe your patients anticoagulants for 10 to 30 days, reducing the risk of DVT and PE occurrence. What about the risk of serious bleeding complications during or after the surgery? As you know, studies have shown that about 5% of patients taking anticoagulants will suffer from serious bleeding complications. You don't want any of your patients to be among those 5%. Till recently, there were no proven alternatives to anticoagulants, but things have changed. Based on the extensive clinical studies outcomes, ActiveCare is also ACCP 2012 recommended as standalone therapy without the need of drugs for DVT, PE prevention after total joint arthroplasty for the whole duration of treatment from hospital to home. ActiveCare is not an IPC. It is a comprehensive alternative to anticoagulants. ActiveCare was clinically studied head-to-head with anticoagulants and was proven to be non-inferior in DVT PE prevention. IPCs were not. How does it work, and what makes ActiveCare unique? Every single individual has his own venous phasic flow. Once the ActiveCare sleeves are applied on the legs, it identifies patient's natural, unique venous phasic flow and begins to monitor it online. Unlike IPC devices on the market, this monitoring triggers the sequential compression so that it is in sync with a specific patient natural venous phasic flow, thus consistently creating each compression cycle a very high pulsatile flow and reaching high peak venous velocity at the common femoral vein. ActiveCare is the only device that syncs the compressions to the patient's individual venous phasic flow. ActiveCare is a portable, comfortable device allowing the patient to receive 24/7 DVT PE prevention throughout all the duration of treatment in and out of the hospital. ActiveCare is already in daily use in numerous leading surgical centers in the USA. None of the other existing medical devices were clinically proven to be non-inferior to anticoagulants in DVT PE prevention. Now, let's summarize the benefits and take a look at the following comparison. Both ActiveCare therapy and anticoagulants are equally effective at DVT PE prevention. They just work differently. While anticoagulants systemically influence the body's ability to coagulate, ActiveCare applies gentle compression to the legs, increasing the speed of blood flow in the veins and by that reducing the risk of clot formation. Anticoagulants increase the risk of serious bleeding complications, while the ActiveCare does not. Side effects. Almost no side effects. If you're tired of juggling risk of major bleeding complications, blood clots formation, do not hesitate to contact us for more information. Visit our website to learn more about ActiveCare or contact us for more information.